So you've chosen to work on the Early Childhood Medical Home Project. I have a confession to make. That is my favorite topic. The reason being that the birth to 5 or the prenatal to 5 age range represents this unbelievable, unparalleled opportunity to influence children. Something that's called the life course model shows that the smallest intervention or support during those early years has unbelievable long-term return, be it on health, education, productivity. So many times we don't start kids out right. There are so many disparities. For example, poor children who don't have access to quality early education, they simply, predictably, don't do well in school. They are often caught up in a cycle of school failure, frustration, even interface with the criminal justice system. That's just one example. For example, a children exposed to a parent who is very depressed or uses substance in the earliest of ages has really poor outcomes from a variety of health, educational, and other risk sort of taking measures. And so we know that when they are exposed to positive education, positive role models, particular programs that really can impact their development, that we can have a long-lasting, long-range benefits as opposed to being so reactive down the road. And for example, investing in prisons or investing in special education. A very concrete sort of pediatric example of the importance of early detection is developmental or autism screening. How very important that if we can understand something at an early age, identify it, refer to appropriate services, the outcomes are just tremendously impacted for good. Um, and so if you look in the Google Docs site, which you'll get the login for in your email communication, you will see a special folder called Early Childhood Medical Home. And within that, you'll see something called the Early Childhood Medical Home Project. And that's the overall project work plan. So I'm going to review it for a moment with you. And as I'm reviewing it, I want you to be thinking as to which aspect of it interests you the most and which part of it you want to really focus on and develop your very own work plan around so that we can, really create the whole vision of the project. So the vision of this project, the overall one, is that the initial focus will be on 3 core early childhood issues, including early learning, maternal depression, and breastfeeding. As I told you, all our projects are structured to have outcomes and plans on the clinical, community, and policy levels. So at the clinical level, the clinical venue will be transformed to maximize opportunities to support the early learning, including early literacy and school readiness, social emotional development, including maternal mental health, and maximize breastfeeding education and supports. The waiting room outreach process, anticipatory guidance, screening, and linkages with resources will be built to ensure the greatest start for young children. Resources and processes will be created with family and provider assessment input. At the community level, we'll partner with community organizations to enhance linkages to supports for young children, as well as implement outreach and education in WIC and early Head Start centers around early learning, maternal depression, and breastfeeding. We'll engage in physician outreach through the AAP chapter, ACOG chapters to disseminate toolkits and best practices around practice transformation and build upon Early Childhood Medical Home website. At the policy level, we'll engage in policy advocacy around reimbursement for depression screenings and other clinical screenings, funding for Reach Out and Read, supports for quality home visiting, and early education. We will also link with ongoing efforts of the Early Childhood Advisory Council, which I am a part, which is advisory to the government and working on some very big initiatives, including a huge parent toolkit that's ultimately going to be disseminated to all parents, that's working on an initiative that's focused on universal developmental screening, which we know is recommended by the AAP, for example, but just not implemented in so many practices, as well as infusing social emotional supports and other issue areas across a variety of settings. And so the work plan of the project has to do with achieving all of these goals. Some of them were worked on quite well. For example, there's an environmental scan that was done that's just a great model of any kind of work that needs to be done on a clinical level. One of our residents looked at our Teresa Lang clinic setting step by step with several patients and identified all the opportunities in terms of time and space and content that we could infuse early childhood supports, anticipatory guidance information. And you can see that document labeled environmental scan in that area. Around that area was implement Project PK. So Project PK is a way to infuse early learning into the clinical venue. Specifically, we know that there is some funding for pre-K for all 4-year-olds in New York City. However, for some time that program was under-enrolled. And we thought, what better of a venue than the pediatrician's office, who sees so many 3 and 4-year-olds, to reach out to parents and families and educate them about the availability of this incredible resource. There are a beautiful brochure and poster that was created that you have access to on the Docs for Tots website, as well as a very specific brochure that was created by one of our residents in Queens, around linking families with opportunities for pre-K. And so then the challenge becomes, how do we make sure that the docs are actually sharing this information? So one simple way would be having this available in the waiting room, and again, working with staff to make sure that that's constantly replenished. One other way, which one of our very brilliant residents came up with, to both for Project PK, linking with families with information about pre-K, but also for a variety of other early learning support information, which we identified to have some very excellent existing brochures through the Born Learning campaign, which really is very age-specific information on early learning. We thought of using Reach Out and Read as a vehicle through which to disseminate information on early learning, including linkages with pre-K in the community. And so really trying to ensure that, for example, where the books are kept, can we keep these brochures and information well stocked? Can we remind the docs to make sure that this topic is very specifically addressed in terms of anticipatory guidance around that? Some of the next steps around this would be ensuring that this is happening across sites. So if any of you have clinic at RGP, this may be a really great topic to take on. Although Teresa Lang, it started to be implemented, there's definitely opportunities to enhance that. I'm sure the same is true of Long Island City Clinic. Another opportunity within the clinical level is that we have some really wonderful resources that were created around breastfeeding promotion. And so how do we better make sure that these are constantly available to families, that all staff are educated as to how to share this information. This information includes sort of nitty-gritty supports around breastfeeding, as well as very specific community organizations that families might reach out to for more assistance and help and support around breastfeeding. We find this to be very clinically useful. Can we now have this material available, for example, on a web? Can we work in our clinical settings to better disseminate that? Those are all examples of opportunities on the clinical level. We are also looking specifically at the Teresa Lang Center. We now have an opportunity to play DVDs in our clinic waiting room, and I happen to have a lot of DVDs that are really focused on early learning and other early childhood issues. So how do we make sure that they're constantly looped? Can we get them through the approval process? Can we show them and display them and ensure that that waiting room is tapped into to maximize education around early childhood? At the community level, with the Early Childhood Medical Home Project, there was also some exciting work done, and I'm sorry, just to go back to the clinical level, this sort of spans the clinical community policy level. There is a very well-recognized initiative called the Baby Friendly Hospitals Initiative, and you can go online and explore what very specific requirements that has. At all of our hospitals, there is working towards obtaining status as a baby-friendly hospitals initiative, and so some of our residents started to participate in some cross-disciplinary discussions with mother-baby folks and other folks within the hospital to help to achieve those very meaningful goals, and that's another area that you can choose to work on. At the community level, around breastfeeding, one of our residents started conceptualizing a wonderful sort of warm line around how do we better make ourselves and others available to support folks in their breastfeeding endeavors. We know that parents are often interfacing with pediatricians first, but many are not trained in this. So, how do we ensure that they're appropriately referred to the right community resources? One resident actually established a Google site that we could conceptualize, providing some responses to emails in terms of linking families with communities. Can we work with other organizations such as WIC and make sure that there is a lot of discussion about breastfeeding, that information is available to families, that we are sort of properly educating folks in this area? Can we work with our local Head Start and daycares to ensure that even for working parents or parents who aren't always with their children, that there are sort of baby-friendly policies in place at those levels? At the community level, in terms of issues of early learning, you have the opportunity to work with Early Head Start and other early learning venues. How can you help actually promote health in those venues? What contribution can you have to educate the teachers and the other staff there to maximize their opportunities to interface with and promote the health of the children that they deal with? How can you educate the media? There are certainly opportunities to share the critical importance of the early years in terms of early learning and share community resources that are available to support early learning and practice. And there's a real opportunity to do that. You also will have the opportunity, if you so choose, to contribute to a project through our local AAP chapter, whose aim is to link pediatricians specifically with what we call child care resource and referral agencies, agencies that are exclusively dedicated to sharing resources with families about how to choose quality child care and early learning, how to finance it if they are eligible for any kind of financial support, as well as providing technical assistance to early learning centers around health promotion. So those are all areas that you can have the opportunity to really influence. Another sort of community level piece around early learning is